Ladies and gentlemen, what do you know about long COVID? Doc, I just don't feel like my normal self after my COVID infection. I seem to have muscle ache, shortness of breath, chest discomfort, feeling tired, and not being able to do my daily routine, and feeling depressed after my positive COVID months ago. Now what? Are these post-COVID lingering symptoms authentic? Or is this simply a malingering behavior that patients try to make the life of physicians become difficult? Now, if this is truly a long COVID syndrome, then is it really as benign as some people may think? Stay tuned, folks. To date, universal clinical case definition for long COVID is yet to be defined. In terms of symptom duration, a slight difference from various sources or agencies being reported, but at least 4 weeks symptoms duration is being defined in most cases. CDC reported as new or returning or ongoing health problems in people who have at least 4 or more weeks symptoms after the first infection with SARS-CoV-2 viruses. WHO has defined long COVID pretty similar to CDC, with slight variation in timing definition, and is said to be within 3 months of initial diagnosis and symptoms lasting for over 2 months. There is a wide range of symptoms being reported, and over 200 symptoms were documented. The symptoms may range from breathlessness, memory disturbances, so-called brain fog, fatigue and gut system symptoms to many other vague body organ symptoms. Fatigue is the most reported symptom in all the surveys done. Other commonly reported symptoms are cough, headache, muscle ache, sore throat, loss of smell and taste. Here comes the challenge in diagnosing the long COVID syndrome by physicians, when all patients present with different sets of symptoms, some have 1 or 2, yet others have more than a dozen of symptoms. So, how on earth a physician is able to deal with over 200 symptoms reported by patients, and make a definitive diagnosis of long COVID? Unfortunately, some patients may be wrongly diagnosed as having malingering, although these patients may just simply be opening up about the ways in which they are suffering from long COVID. The lack of solid scientific explanation and understanding of post-COVID syndrome diminishes the veracity of their complaints, and makes these unfortunate patients labeled as nerd, and being difficult by the physicians. Some researchers isolated 3 distinct COVID variants, based on clinical symptoms profiles to define long COVID. Perhaps, this may make the life easier for physicians in terms of making long COVID diagnosis. They are not perfect, but at least somewhat helpful clinically in terms of long COVID recognition. The first, also the largest among the 3 profiles, is nervous system-related symptoms, namely fatigue, brain fog, and headaches. The second profile is lung or breathing system related, which encompasses symptoms of breathing difficulty and chest discomfort implying underlying respiratory dysfunction. The third profile is less concrete, consisting of multi-organ symptoms, such as heart palpitations, muscular ache, as well as hair and skin changes. A vague subprofile involving stomach and intestinal symptoms may coexist with any pre-mentioned 3 major profiles. Thus far, no concrete data to support those who are at less risk in developing long COVID after infection. In essence, everyone is at risk of long COVID regardless of age, gender, race, smoking status, pre-existing medical conditions, or healthy persons. However, some data seems to suggest vaccination may help diminish long COVID risk, although there is no difference in symptom presentation across vaccinated and unvaccinated groups. Other sources reported that those who have headache, sore throat, prior severe infection, or underlying morbid obesity seem to be at higher risk of long COVID. Currently, there is no concrete scientific answer to the pathogenesis of long COVID. All we have at this point is the scientific hypothesis. The top hypothesis is the viral RNA, or proteins that persist in the host's tissues or cells, triggering chronic inflammation. Alternative hypotheses are exaggerated autoimmune responses with uncontrolled organ damage and dysfunction, as well as disturbed gut microbiome environment, so-called dysbiosis. The biological mechanism responsible for long COVID remains mysterious, as for today, and long-term research may help to disentangle the mystery. Researchers have been lucky to prove a higher reduction in brain cortical thickness or gray matter thickness, as well as higher tissue damage markers in the olfactory cortex in those COVID survivors versus the matched controls. The mechanism behind the loss of the brain cortex remains unclear. The gray matter is involved in signal processing, much like a computer CPU, whereas the white matter serves as communication between various gray matter areas in the brain. In case you are unaware of, the olfactory cortex is the brain area that regulates smell and taste, as well as emotion too. The cortical brain atrophy may likely explain clinically reported brain fog described as confusion, reduced cognitive ability, mental health disorders with lethargy. We are yet to understand if long COVID is fully reversible, as some patients appear to recover gradually from symptoms over time, but full recovery has not been reported, at least not less than 2 years at this point, in terms of full clinical recuperation. There is no definitive treatment yet available for long COVID, but theoretically the medical treatment may be different from one sufferer to another, depending on the disease etiology identified. For instance, an autoimmune dysregulation means immunosuppressive therapy, whereas persistent viral infection may be treated with antiviral therapy. The take-home message is, there is compelling clinical data to support the complaints of long COVID symptoms are genuine, and it's unfair to drive patients to think that they are just simply a burden, or being difficult to others. All we have now is being supportive, and listening, at least until one day, a more definitive solution to long COVID is available medically. Until then, let's pray for the best.